Bismillahirrahmanirrahim. Assalamu alaikum. Today's topic is Al-Zahrawi, a very famous name, very famous Arab scientist who influenced modern surgery. The most influential person who shaped surgery as it is today. So this is I think, sixth or no, seventh in this series of eminent Arab scientists. There will be two or three more, and then I will move on to eminent Persian scientists. Okay, let us start. Al-Zahrawi, his real name was Abu al-Qasim Khalaf, and he lived from 1936 to 1013 AD. And generally, he is known in the East as Al-Zahrawi and in the West as Albucasis. So he was not only a surgeon, he was a physician and a chemist also, and he belonged to Undulus, Arab, a part of Arab world. So he was born in the city of Azahra, which is near Cordoba, that is Cordoba in Undulus, and he is considered to be the greatest surgeon of the Middle Ages and is often referred to as the father of modern surgery. So his contributions to surgical procedures and instruments had profound effect both in the East and all in the West, and that effect is felt even today. And many of his discoveries are still practiced in the world even now, after more than 1,000 years. So you can imagine how great a scientist he was. Let us, his scientific achievements are many. So I will just go through them floatingly. Number one, he was the first person to use catgut for internal stitching. And this method is still practiced in modern surgery. So catgut is actually the dried intestine of the animal, especially sheep, which is very resilient. I don't know why it was given the name as catgut, because the intestines of sheep are used, and it doesn't break. And the most important thing why it is still used is that it is naturally is absorbed in the body. You don't have to remove it again from the body after stitching. So that is its greatest advantage. And Al-Zahrawi was the first person who introduced this method. He was also the pioneer of neurosurgery and neurological diagnosis. He is known to have performed surgical treatments of head injuries, skull fractures, spinal injuries, hydrocephalus, and headache. And he was also the first physician to identify the hereditary nature of hemophilia. You know what is hemophilia? In this disease, the blood doesn't clot, and if there is a cut, it will keep blood bleeding, and patient may die from that. So he explained that this trait passes from generation to generation. And he was also the first person to describe a surgical procedure for ligating the temporal artery. This artery is on our right side near the ear, and it is the major cause of headache and especially migraine. And he was, and if you ligate it, I mean, if you constrict it or if you do surgical procedure on it, then this migraine is cured. So he was the first person to do that. And but the West, this is attributed to Ambrose Paré, who used this procedure almost 600 years after Al-Zahrawi. Similarly, I used the word hydrocephalus in a previous slide, so here I will explain it. And he gave the first clinical description of an operative procedure for hydrocephalus, which clearly describes the evacuation of superficial intracranial fluid in hydrocephalic children. Here it is in this figure, tells all that in the left side is the normal amount of fluid in the brain, and this fluid may increase due to various reasons, that is cerebrospinal fluid, and that the problem it causes is called hydrocephalus, and it puts pressure on the whole brain. And he is also credited to be the first person to use Kocher's method for treating a dislocated shoulder. It's quite a complicated method and beyond the scope of this vlog. So this procedure should have been named after him, not Abel Theodor Kocher, because he was the first person who described it, Al-Zahrawi. Similarly, water position in obstetrics, he was the first person to instruct it. He was also the first to describe an abdominal pregnancy that in those days was a fatal affliction. You know, the normal pregnancies, the fetus develops in the uterus, but sometimes it starts, it's dislocated and the development occurs in the abdomen. So it is, even in modern days, it is a big challenge to save the mother and child. But in those days, it definitely meant that. So, but he was the first person to describe it. Similarly, he was the first person to discover the root cause of paralysis. You know, in paralysis, different the part which is affected, it is patient is unable to move it. And look how diverse are his contributions. He was also the first person to develop surgical devices for cesarean sections. You know, cesarean sections, that is, the abdomen is cut and the child is brought out. And cataract surgeries, cataract, which is so common these days. So he performed this cataract surgery the 1000 years earlier from modern time. And he also used cauterization. And cauterization, as you know, can be done by a solder, that is electric, by heating something, or by a chemical, as shown in this figure, that is to burn that area or to make it non-living. So some tumor or some diseased part, it can be as by this method, it will not spread into neighboring tissue. And he was also the first to illustrate the various cannulae and the first to treat a wart with an iron tube and caustic metal as a boring instrument. You know that what are cannulae? On the left side, you can see even whenever somebody has some problem or some intravenous drip has to be given, We use this cannoli even now. And he was the first person to use them. And also, he used iron tubes to cut off these warts that are shown on the right side, which are again a very common problem these days. In in urology, he developed methods to take stones out of the bladder without surgery. He invented a new instrument known as Kitab, and he was able to crush the stone inside the bladder without the need for a surgical incision. And here you can see this is a diagram of that Kitab. It can be closed and it can be open, and the stone can be crushed between its pincers. And he was also the first person to use gold and silver wires to ligate loosened teeth, and has been credited as the first to use replantation in the history of dentistry. And in pharmacy and pharmacology, he pioneered the preparation of medicines by sublimation and distillation. You know that sublimation is direct conversion of a solid to a gas, and in distillation, uh, in a liquid mixture, different components they evaporate at different temperatures, and so we can separate them from each other. He introduced over 200 surgical instruments, which include different kinds of scalpels, retractors, curettes, pincers, specula, and also instruments designed for his favorite techniques of cauterization and ligature. He also invented hooks with a double tip for use in surgery. So these are diagrams made by himself of different instruments which he used. So he treated a slave girl who had cut her own throat in a suicide attempt. He sewed up the wound and the girl recovered, thereby proving that an incision in the larynx could heal. Now some salient facts of life. He lived most of his life in Cordoba, that is Cordoba. He studied, taught, and practiced medicine and surgery until shortly after his death, before his death, in about 1013 AD. So he was a court physician to Andalusian Caliph Al-Hakam II. So in Cordoba, which is under Spanish rule these days, there is a street which has been named after him as Calais Albucasis. He lived in house number 6, which has a bronze plaque which reads, "This was the house where Al-Zahrawi lived." His principal work is Kitab al-Tasrif, a 30-volume encyclopedia of medical practices. So you can say 30 books, given one name. The surgery chapter of this work was later translated into Latin, attaining popularity and becoming the standard textbook in Europe for next 500 years. For 500 years in Europe, it was the standard book for teaching surgery. It was completed in year 1000 AD, and this book covered a broad range of medical topics, including surgery, medicine, orthopedics, ophthalmology, pharmacology, nutrition, dentistry, childbirth, and pathology. And of course, the most famous among them is a chapter on surgery that is named On Surgery and Instruments. And it is the last volume, and he, Al-Zahrawi, explained why it is the last volume, because he considered surgery as the highest form of medicine, and he thought that one must not practice it until he becomes well acquainted with all other branches of medicine, right? So first, he urged people to first read the earlier volumes and then read this volume. And in this book, it is the first illustrated surgical guide ever written. And he drew diagrams of each tool in this, which is used in different procedure in color, and clarified how to carry out the steps of each treatment. And now, when this Kitab al-Tasrif has been studied in depth, it has been revealed that early descriptions of some medical procedures that were ascribed to later physicians. I have given one example already. I mean, actually, the credit should be given to Kitab al-Tasrif, Al-Zahrawi. And this book was translated in the 20th century by Gerard of Cremona, in the 12th century, sorry. And as I said, that it became very popular in Europe, and it was used as standard text in all major medical universities of that time, like Salerno and Montpellier. And remained the primary source of surgery in Europe for the next 500 years. Historian of medicine Arturo Castiglione wrote, Al-Zahrawi's treatise in surgery held the same authority as did the canon of Avicenna in medicine. So Avicenna, everyone knows Ibn Sina. He was a Persian scientist. So his canon in medicine was also as a textbook in Europe for 500, 600 years. And same was the status of this Al-Zahrawi's book on surgery. So these are the different references used for this vlog. So next, inshallah, will be Al-Jazari. And in the end, you can reach my vlogs by tapping Awaz Dost Dr. Abdul Haq in search window and getting my URL. You will click on it and you will have access to all my previous vlogs. So thank you very much for your attention. Allah Hafiz.